As growth continues in southeastern North Carolina, so does the need for cancer treatment.
We reported last year Novant Health was battling a cancer provider shortage, leading to longer wait times for patients. WECT's Connor Smith following up with Novant 1 year later. So Connor, what do their staffing levels look like today?
Yeah, Novant says they've gotten their oncology staffing up to healthy numbers. Still, they're battling the same problem providers around the country are and trying to treat patient lists that are only getting longer. Inside the new Scotts Hill Medical Center, Novant Health doctors are trying to keep up with rapidly growing demand for cancer treatment in our area.
Unrelenting, I guess, is one way I would sort of describe it.
Dr. Michael Papagikos is a radiation oncology medical director for Novant Health.
This is the meat and potatoes of radiation oncology.
We followed up with him 1 year after he detailed Novant's cancer provider shortage.
Recruiting and retaining medical oncologists and all of our oncology subspecialties is essentially a full-time job.
At the time, Novant had just 8 oncologists covering our region. That was in line with national trends that are only getting worse. The Association of American Medical Colleges predicts a national shortage of more than 10,000 oncologists by 2030. But Dr. Papagikos says Novant has boosted its staffing over the last year.
I'm just super proud of the improvements that we've seen over that last year and just the Herculean efforts that have gone into that.
He says Novant has added 5 new oncologists with 2 more set to start later this year. Those include new doctors here at Scotts Hill, but also at the Zimmer Center in Wilmington and other centers in Brunswick County.
We're never going to be fully staffed for the future. I think we're very well staffed for the present moment right now.
And Novant believes that will help keep patients in our region healthier and more likely to stay close to home when they need treatment. Novant says a year ago, cancer patients were waiting roughly 20 days for appointments, but they say today that average wait time is down to around 5 days. Their goal is to get it down to 3. Connor Smith, WECT News.